This is the Andrea Tantaros Show.
Clearly, they did not do the cheapest bid on this contract. It was a Canadian company. They spent over $500 million of taxpayer money. Spotify cost maybe 10% of that. You look at Twitter. You look at other software products that people go online and whether they're exchanging information or purchasing products, those websites cost a whole lot less money to develop, and those websites work, and they handle more traffic.
Welcome back to the Andrea Tantaros Show. I'm Sam Sorbo sitting in. 800-876-4123 is the number. Yeah, it's interesting. It was like $550 million to the Canadian company. Wasn't it $550 million to Solyndra also? What is it about that figure, I wonder? I have a special guest joining me. Bennet Kelley is the founder of the Internet Law Center. He's also host of Cyber Law and Business Report on webmasterradio.fm. Welcome to the show.
Thank you. Thanks for having me.
I'm told that you're here to defend the Obamacare website. What's up with that?
Well, obviously it hasn't worked in an ideal fashion, and there have been glitches, and they need to be addressed. In addition, a review needs to be done to figure out why this happened. But obviously, the first priority should be making sure we get this up and running at full capacity as soon as possible. But it's not the first time we've had glitches in major rollouts. We had glitches with the launch of Social Security, and we had glitches with the Bush administration with the rollout of Medicare Part D.
Right. You realize you're not making a case for big government at all. You're pointing out how big government screws things up.
Actually,
like no one in the private sector.
Yeah, even in the private sector. I used to work with a ticketing company, and we would have a major, Rolling Stones concert going live, and sometimes you would have a glitch or there'd be a coding error, and all of a sudden the capacity level would reach a certain amount, and the system would go down. That used to be frequent.
And then what would happen?
And then we go into Code Blue, we get it fixed, and get it back up and running again.
How quickly would you get it fixed?
Depending on the nature of the error.
Did anybody get fired?
Sometimes, yes.
Yeah. And yet here we are. First of all, I defy you to call it a glitch. It's not a glitch when nobody can log on, and so few people are getting their health care security. So please don't call it a glitch. When they spend $550 million on a website that does not work, you cannot call that a glitch. A glitch is, a ticketing company that takes a few hours to get things back online. That's a glitch, but a glitch does not last for 3 weeks. But secondly, go ahead.
There over 500,000 people have applied, and the state exchanges, which are being more adaptable, have been working much better than the federal exchanges.
Right. How many people have applied? 5?
My understanding is over 500,000 people have applied.
Yeah, they actually won't give us that data. So it's interesting that you have it. I don't have that data. But if we say that those people applied, they still don't have their health care. So they don't count. You can't count them until they get their health care. Right? And then, of course, it remains to be seen what kind of health care they get. We have so many instances of people whose health care costs are doubling, tripling, quadrupling when the promise was made that premiums would drop by $2,500 annually. So how do we answer to them for that?
Well, I think the record is that the premiums are dropping. In most cases they are. I saw a review of one program where the charges were made that the premiums were going through the roof, and the person didn't really even look on the exchange. Another reporter went through the exchange and found the person could have got much cheaper coverage.
Oh, so it's again the website that's the problem.
No,
because I'm seeing reports that a nurse practitioner, 33-year-old single father, first of all has to now go to part-time work because his job is not going to take care of his health care costs. And his premiums, his annual deductible is going to be $12,000 versus $3,500, and his monthly premium is going to more than double.
Well, one, there's no evidence of people being shifted to part-time work. Bureau of Labor Statistics just came out with evidence of that. Two, all expectation, and so far the evidence is that premiums are lower. I just talked to an insurance agent who said that she's been signing up people right and left. And so, I think
and yet the reports also indicate that Barack Obama asked Blue Cross Blue Shield not to reveal any of their enrollment data because it's embarrassing for him. I'm looking at a report done in Illinois that says that since 2011, Illinois has lost the equivalent. This is Barack Obama's home state. Illinois has lost the equivalent of 66,000 jobs in 3 different employment sectors. That loss is more than the number of jobs added in all sectors over the past year. So even in his own home state, the Affordable Health Care Act, the Unaffordable Health Care Act is actually wreaking havoc.
I don't follow. Just because Illinois is losing jobs, that's because of the health care?
Well, because they're losing jobs in the private sector, they're losing full-time jobs for part-time jobs. Yes. Yes, I think you could probably draw a line straight back to Obamacare.
The labor statistics is that this is not occurring. I mean, that's the talking point.
Okay, but then let's just go to the general overall picture. Where's the recovery? Where is it? Because I haven't seen it in 6 years.
Well, the recovery through the exchanges is more. It's basically, ironically enough, I mean, the Obamacare is the Republican alternative to Hillary Care from 1993. It was Senator Chafee's bill that 20 other Republicans.
Yeah, if you want to call it, you can call it Republican all you want. I'm still not going to be for it. I don't care what name you want to give it. It's socialized medicine.
Well, no,
or it's the next step toward socialized medicine.
Republican response to Hillary Care. And by creating the market exchanges, you're using market forces to give more supply and bring premiums down. It's classic, market economics.
Why aren't everybody's premiums coming down then? Why are there reports of premiums going up? Are you just discounting them? You just don't believe that premiums are going up? Those people are lying?
And I don't know. I do not know. But I think on balance, I think what I'm hearing from insurance agents is that people are saving this way. I mean, some people may have unique.
Maybe you're only listening to the parts that you want to hear. Have you thought about that? Because there are reports that premiums are going up for people.
Well,
and on average works if you're the president of the United States. But if you're Joe Schmo in Nevada and your premium doubles, then you don't really give a crap about the average because you're out twice the amount of money to have half the health care. Maybe you should be listening to the people whose premiums are doubling.
It's going down because there are more people competing for my business.
Well, that's exciting for you. I don't think that we can replicate that experience anywhere else, but good for you.
And but the other thing where savings will occur, I think by having greater access to health care, we can do more preventative care, and that's going to save us big time on the back end because so much of money is
like preventative care, like making sure that people don't drink sugary drinks.
No,
because that leads to diabetes.
Do their health checks at the emergency room.
Making sure that people don't smoke because that leads to lung cancer.
You can pay me later. I mean, basic preventive care can save millions and millions of dollars down the road.
Can you show me where the government has been successful in a private practice kind of situation?
A private practice kind of situation, such as in
what business?
Running an enterprise?
Yes, running an enterprise. What business has the government run successfully
Tennessee Valley
in competition?
Administration.
The what?
The Tennessee Valley Administration. A lot of public utilities run fine.
Run fine. Oh, well, that's good, because fine is what we're after. Yay, it's all fine. Can you explain to me why you were sent to China to explain our nation's internet laws to the Chinese?
Why I was sent? I was asked to participate, and I joined. I was every year the U.S. and the Chinese Ministry and Department of Commerce do a legal exchange. And whoever's hosting, which last year was the Chinese, gets to pick the topic. They picked the topic of e-commerce, and I was asked to go since that's one of my areas of expertise. Well,
that's really a great thing, and congratulations. I wonder why they're interested in our internet laws.
They've just surpassed us in terms of the number of internet users, not in terms of volume of commerce. And they don't have a legal and regulatory structure to get their arms around it, and they're trying to understand it. At the same time, they're also very fearful of it.
They're fearful of?
They're fearful. I mean, they didn't say this, but you get it by being there. They're fearful of the internet. They have, I think, over 1 million people who monitor people's internet communications.
Why?
Why? And they find social media very threatening, because obviously when you have a large mob in China, they're just afraid of people being mobilized through social media to act against them.
Do you think that's reflective of the NSA monitoring our internet usage?
I think that is something that needs to be. We need to remove the curtain there, and just we need to have a discussion of what it is that we are allowed to do, and what are the requirements and safeguards we want to have in place. It's just extremely frustrating each week to see a new revelation. A new head of state we spied on, a new area where we're looking into, and I think we need to do a better. I think the administration needs to do a better job in crisis management and just getting everything on the table and making sure and restoring confidence. Because frankly, I think it's going to hurt. It's hurting U.S. business because already people overseas are less reluctant to do business with some U.S. providers because of concerns about the NSA.
Right, they're more reluctant, I think, is what you meant to say.
Yeah, there's there's actually.
You said we should have a discussion about what we're allowed to do. What is?
Yes.
But who's allowed to do?
Well, I mean, the whole if for example, the whole FISA framework. Obviously, government. We've just always had some level of monitoring. It's just where do we draw the line? It seems that the line just got blurred at a certain point, and the NSA ran with it, and so. Let's talk about where that line should be in a modern era, and let's make sure that it's consistent with the Fourth Amendment, and that we have safeguards in place to make sure it's not abused.
Well, we certainly agree on that point. Thank you so much, Bennet Kelley, for coming on the Andrea Tantaros Show.
Thank you.
I am Sam Sorbo, sitting in 800.